It's a procedure done by the anesthesiologist at the labor and delivery area, and they come in at a certain time of the laboring process where the patient has been pre-treated with some IV fluids to prevent drops on the blood pressure, and then they basically place a small needle in the patient's back in a special place where they can inject some medication, an anesthetic that will help numb those nerve endings from the waist down, thus creating that relief of pain where the patient needs it most, which is in the birthing process. The disadvantages of the epidural is that the patient has no control over the actions that she will have during the birthing process because she's going to be numb. And some patients don't like that. They want to have full control of their extremities, their legs, and they also want to engage some of that urge to push. That's the term, the urge to push, that comes along with having the baby's head in your pelvis. So you lose that. But we have the nursing staff and the capability of coaching the patient with an epidural to do the same gestures and efforts to be able to deliver their baby. And all these disadvantages are at a smaller scale. They don't happen all the time. They do happen, like with anything else that you do in life, but they happen in a smaller scale, and usually we have countermeasures for pretty much everything that we have as disadvantages for it. We have also that sometimes it'll slow down the laboring process. The contractions might mellow down, but again, we have countermeasures for that. We use Pitocin to enhance the contractions at all times if we need to, whether you have the epidural or not, because ultimately we want to deliver the baby. Also, by placing the epidural, we numb basically from the waist down, and that can cause certain dilation or expansion of the blood vessels from the waist down, which causes a drop in the blood pressure that sometimes will happen after an epidural. Again, we have countermeasures for that. We usually give the patients enough fluids beforehand, and if it happened that the blood pressure went down abruptly or suddenly, then we have some medication to counteract that. As far as the husband's or the father of the baby is concerned, the epidural brings an extra edge, a positive edge, I think. And now we're going into the advantages of it, in the sense that once he's in there with his wife waiting for the big moment, that could be just a few hours or many hours. We're talking about 12, sometimes 18, 24 hours of laboring until you finally deliver your baby. During that time, the epidural gives the advantage of having a comfortable laboring process, in which I tell my patients, look, you could be playing cards with your husband, talking to your family that came to visit from out of town, watch movies, there's free pay-per-view in the hospital, and have a relaxed atmosphere and a relaxed sensation while you wait for your baby to come to the world. And so that also helps the family, and not only the father of the baby, but the family in general, to feel comfortable, to feel that they're in a home environment while they're waiting for the baby to be born. It creates less anxiety and creates less stress. And in some patients who have a lower pain threshold, creates or enables an emotionally positive experience. The other advantages of the epidural is that it also helps relax the muscles in the pelvis, which when you're in pain, you try to sort of contract everything, all your body. by relaxing, it creates that additional space, so to speak, for the baby to come down. It also enables for while you're in the delivery process, if there is a complication, the heart rate goes down in the middle of delivering the baby, we can act quickly to get the baby out. The added benefit for having this control on the epidural is that once the delivery process is done, they can shut off the epidural and the patient regains her function of her legs within an hour or two. So by the time she goes from labor and delivery to the postpartum unit, which we have separate delivery rooms and postpartum rooms here at Atrium, they have regained almost all their mobility, and then they can go about their business with their new baby and celebrating. Well, as a father of twin girls, I can tell you that being in a place where you get all the amenities, where you feel at home while you're waiting for the delivery of your child, brings that sort of homey comfort, that easiness, that smoothness in the process that anybody would like. I would love that for any other dad out there, to enjoy those moments with their wife while she's laboring, and then enjoy that beautiful moment of their child being born.